my name is Mary Catherine. I'll be your nurse for the day. What's your name?
Scott.
Is it okay if I call you that?
Yes, please.
Can you tell me your date of birth?
March 7th, 1964.
Perfect. I'm just going to perform some hand hygiene and then we'll do a health assessment. Okay, so normally I would take your blood pressure, your temperature, and your O2 stat right now, but I don't have that equipment, so we're just going to pretend like I did that. And then now I'm going to check your pulse. Alright, your heart rate is 75 beats per minute, and now we're going to observe your respirations. Alright, you are breathing at a rate of 14 breaths per minute. Okay, so do you have any pain anywhere?
No.
Okay, perfect. Now I'm going to do a neurological assessment on you. Can you tell me the date?
February the 17th, 2021.
Perfect. And can you tell me where you are?
Memphis, Tennessee.
The patient is alert and oriented ×3. The patient's behavior is appropriate for the situation. The patient's facial expressions are appropriate for the situation. The patient's affect is appropriate for the situation. Now I'm going to check your reaction to light, so if you just look straight ahead. The pupils are equal, round, reactive to light, and accommodating. Now I'm going to check your sensation, so just close your eyes and tell me when you can feel it.
No. 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 No.
Perfect. The patient sensation is intact. Now I'm just going to have you stand up and just walk right to the end of there and back for me. Perfect. And then you'll just come back. And then go sit down. The patient's gait is appropriate. Now if you'll hold your arms like this and don't let me push them towards you. Don't let me pull them. Okay, and if you'll lift your arms up, out, and then back down. And then I'm going to try to pull your legs. Don't let me. And push them. Don't let me. Okay, the patient has full range of motion and full strength in upper and lower extremities. Now I'm going to check your skin. The skin is, the color is appropriate for ethnicity. The skin has appropriate turgor. There is no signs of tinting. There are no lesions or edema seen on the skin. The skin is warm and it is dry. Now I'm going to check your respiratory. So I already assessed that there were 14 breaths per minute, and now if you will just breathe in for me. Alright, the lungs are clear, the breathing is effortless, there are no retractions, there is no coughing, no abnormal lung sounds, no crackles, wheezing, or anything like that. Now I'm going to check your cardiac, so if you'll lean your head back for me and tilt your chin a little bit to the left. There is mild pulsation in the jugular vein, but there is no obvious distension. Okay, now I'm just going to auscultate your heart sounds really fast. Alright, S1 and S2 are audible. There are no extra heart rhythms, no abnormal murmurs. And we already did the pulse. Okay, so now I'm going to check your peripheral vascular system. So if you'll just put your arms like this. Alright, the radial pulse is strong. And then if you'll take your shoes off for me. just gonna pretend that you took your socks off, and I'm gonna check your dorsalis pedis. All right, the pulse is strong. The pulse is strong. Okay, now I'm going to ask you a couple questions about your GI system. Have you had any problems? Have you been going to the bathroom more than normal?
No.
Any pain on urination?
No.
Having to go to the bathroom more frequently during the night?
No.
Okay, so there is no frequency, nocturia, or painful urination. Also, if you will lay down for me, I'm just going to check your, auscultate your bowel movements. All right, the bowel sounds are normal, active. Have you had any diarrhea?
No.
Any vomiting?
No.
Any constipation?
No.
Any gas?
No.
And you've not had any incontinence?
No.
Okay, perfect. You can sit up back for me. And the patient does not have any amputations. It has full range of motion in all the extremities. I am just going to have you open your mouth for me. The mucous membranes are pink. They are moist. There are no lesions. Now I'm going to check your capillary refill, so if you can see your hand. The capillary refill is less than 3 seconds. There is no edema and no swelling. All right, is there anything else I can do for you?
I think I'm good.
All right, I'm just going to wash my hands, and that's the end of the exam.